Vikram Gojara from Web 7B. Today's my topic is schizophrenia and mood depressive disorder. So first I'm gonna to explain schizophrenia. So what is the schizophrenia? Schizophrenia is a serious mental disorder in which people interpret reality abnormally. Schizophrenia may result in some combination of hallucination, delusions, and extremely disordered thinking and behavior that impairs daily functioning and can be disabling. People with schizophrenia requires lifelong treatment. Early treatment may help get symptoms under control before serious complications develop and may help improve the long-term outlook. How is schizophrenia diagnosed and test and results? If symptoms if symptoms are present, your doctor will perform a complete medical history and physical examination. Although there are no laboratory tests, no specific diagnosis schizophrenia, the doctor might use various diagnostic tests such as MRI and CT scans or blood tests to rule out physical illness and as the cause of your symptoms. Manifestations. Characteristics of schizophrenia typically include positive symptoms such as hallucinations or delusions, symptoms such as a flat affect or poverty of speech, impairments in cognition including intentions, memory, exclusive functioning. So now pharmacological management. Medications are cornerstone of schizophrenia treatment, and antipsychotic medications are the most commonly prescribed drugs. They are thought to control symptoms by affecting the brain neurotransmitter dopamines. Medical and nursing management. Type of physiological treatment for schizophrenia include cognitive behavioral therapy, usually called CBT, physiocondition, the family psychoseductions. CBT is a type of physiological treatment that can help you feel less distressed about your psychotic experience, feel less depressed and anxious. If you have schizophrenia and surgical management. If you have schizophrenia and medicine doesn't control your symptoms, deep brain stimulations, DBS, this one we call DBS, deep brain stimulations may be an option. It's a new treatment that uses electronic pulse to help parts of your brain communicate better. Than when you get DBS, a surgeon places the worries and electronodes in your brain. So this one we call DBS for surgical management. So prognosis. Most of people with schizophrenia live independently with community support. In people with a first episode of psychosis, a good long-term outcome occurs in 42% of cases, and intermediate outcome in 35% of cases, and a poor outcome in 27% of cases. Thanks. Now gonna disorder. So I'm gonna to explain in mood depressive disorder is like what is the mood disorder. A mood disorder is a mental health problem that primarily affects a person's emotional state. It is a disorder in which person experience long periods of extreme happiness, extreme sadness, or both. It is a normal for someone's mood to change depending on the situation. Like in 5 seconds, we can't say that like whose mood gonna to change in 5 seconds. Like is if happy and after 5 minutes he's gonna to get angry, like that. So diagnostics, test and results. Mood disorders are diagnosed through both physical examination and mental health evaluation. Your physician perform a physical exam to rule out any underlying medical conditions that are causing an effect on your mood. There are no specific blood tests or brain scans to diagnose bipolar disorder. Even so, your doctor may perform a physical exam and lab tests, including thyroid function test and urine analysis. These tests can help determine if other conditions or factors could be causing your symptoms manifestations. Lose of interest in activities that were pleasures in the past, unyielding anxiety, sadness, or feeling of emotions, feeling of worthless, helplessness, or guilt, feelings or hopeless, and pessimism. So next is management. Pharmacological management in this mood step we use mood stabilizers like you will typically need mood stabilizer medications to control maniac or hypomaniac episodes, and examples of mood stabilizers include lithium, valeric acid, diplocarbalanes, sodium carbonized NSM, antipsychotics. If symptoms of depression or mania persist in spite of treatment and other medications, adding an analysis drug such as wanted to explain in this antidepressants, your doctor may add antidepressants to help manage depression, because an antidepressant can sometimes trigger a manic episodes. It's usually prescribed along with a mood stabilized antidepressants, antipsychotic. This is the medication Symphobex combine the antidepressants fluoxetine and then the antipsychotic olanzapine. It works as a depression and treatment and a mood stabilizer, and anti-anxiety medications like benzodiazepine alcohol may help with anxiety use on a short-term basis. Medical and nursing treatment is best guided by a doctor who is specialized in diagnosing treating mental health conditions, psychiatrist who is skilled treatment bipolar and related disorders. You may have treatments team that also include a psychologist, social worker, and psychiatric nurse. Bipolar disorder is a lifelong condition. Treatment is directed at managing symptoms depending on your needs. Treatment may include surgical management. No surgical care include for there is no surgical management for this disorder, because Kasi bipolar disorder hysterotropic treatment was attempted with a psychological surgical procedures as such as performal lobotomy. However, lobotomy is no longer used in the clinical care of patients with bipolar disorder. Prognosis. Mood disorders such as depression and bipolar disorder may recur or be organized. Bipolar disorder may recur or organize, therefore may require long-term of lifetime treatment. It is important to take your medications as prescribed. After starting your medications, it may take 2 to 6 weeks before you begin to notice a change in your symptoms. So that's it, guys. I explained this mood disorder topic. So thanks everyone.
Schizophrenia was first identified more than a century ago, but we still don't know its exact causes. It remains one of the most misunderstood and stigmatized illnesses today. So let's walk through what we do know, from symptoms to causes and treatments. Schizophrenia is considered a syndrome, which means it may encompass a number of related disorders that have similar symptoms but varying causes. Every person with schizophrenia has slightly different symptoms, and the first signs can be easy to miss. Subtle personality changes, irritability, or a gradual encroachment of unusual thoughts. Patients are usually diagnosed after the onset of psychosis, which typically occurs in the late teens or early 20s for men and the late 20s or early 30s for women. A first psychotic episode can feature delusions, hallucinations, and disordered speech and behavior. These are called positive symptoms, meaning they occur in people with schizophrenia but not in the general population. It's a common misperception that people with schizophrenia have multiple personalities, but these symptoms indicate a disruption of thought processes rather than the manifestation of another personality. Schizophrenia also has negative symptoms. These are qualities that are reduced in people with schizophrenia, such as motivation, expression of emotion, or speech. There are cognitive symptoms as well, like difficulty concentrating, remembering information, and making decisions. So what causes the onset of psychosis? There likely isn't one single cause, but a combination of genetic and environmental risk factors that contribute. Schizophrenia has some of the strongest genetic links of any psychiatric illness. Though about 1% of people have schizophrenia, children or siblings of people with schizophrenia are 10 times likelier to develop the disease, and an identical twin of someone with schizophrenia has a 40% chance of being affected. Often, immediate relatives of people with schizophrenia exhibit milder versions of traits associated with the disorder, but not to an extent that requires treatment. Multiple genes almost certainly play a role, but we don't know how many or which ones. Environmental factors like exposure to certain viruses in early infancy might increase the chance that someone will develop schizophrenia, and use of some drugs, including marijuana, may trigger the onset of psychosis in highly susceptible individuals. These factors don't affect everyone the same way. For those with very low genetic risk, no amount of exposure to environmental risk factors will lead them to develop schizophrenia. For those with very high risk, moderate additional risk might tip the balance. The antipsychotic drugs used to treat schizophrenia have helped researchers work backwards to trace signatures of the disorder in the brain. Traditional antipsychotics block dopamine receptors. They can be very effective in reducing positive symptoms, which are linked to an excess of dopamine in particular brain pathways. But the same drugs can make negative symptoms worse, and we've found that negative symptoms of schizophrenia may be tied to too little dopamine in other brain areas. Some people with schizophrenia show a loss of neural tissue, and it's unclear whether this atrophy is a result of the disease itself or drug-induced suppression of signaling. Fortunately, newer generations of antipsychotics aim to address some of these issues by targeting multiple neurotransmitters, like serotonin, in addition to dopamine. It's clear that no one transmitter system is responsible for all symptoms, and because these drugs affect signaling throughout the brain and body, they can have other side effects like weight gain. In spite of these complications, antipsychotics can be very effective, especially when combined with other interventions like cognitive behavioral therapy. Electroconvulsive therapy, though it provides relatively short-lived relief, is also re-emerging as an effective treatment, especially when other options have failed. Early intervention is also extremely important. After months or years of untreated psychosis, certain psychoses can become embedded in someone's personality. And yet, the dehumanizing stigma attached to this diagnosis can prevent people from seeking help. People with schizophrenia are often perceived as dangerous, but are actually much more likely to be the victims of violence than the perpetrators. And proper treatment may help reduce the likelihood of violence associated with schizophrenia. That's why education for patients, their families, and their communities helps erode the stigma and improves access to treatment. Continue to educate yourself about the symptoms, causes, and treatments of different mental health conditions with this playlist.
I hope you like my video and you got it what I'm going to explain there. Thank you everyone. Bye bye guys for watching. I hope you enjoyed my video.